All right. So the overarching brand is Good Sleep Co. So that's our company, and what we do is oral appliances and software. So we have Hush, which is our brand for oral appliances, and actually soon to be some other stuff as well. We have, so basically anything that's physical, that's a product that a patient might use for therapy is hushed. Hush meaning obviously making a person quiet.
Right.
We
Okay.
have
Yeah.
Resident, which is our software operating system for professionals to use. So this is what you guys will use to manage patients that
Okay.
sort of live in our ecosystem. And Sleep Care is a patient app. So that's the app that helps them manage therapy. We help nurture them, educate them, help with overall sleep. And it's kind of like myAir for patients that don't use CPAP. I'm going to just rehash the products a little bit. I'll tell you a little bit about MADs and how they work, and I'm sure you know a bit already. Identifying patients and permanent therapy, we'll just talk a little bit about, how to identify, an easy sort of low-hanging fruit kind of patient that may go straight to a dentist rather than having to worry about putting them on the Hush temporary appliance first. So the way that we
Right.
see it is like
Okay.
the boil and bite hushed is kind of like a CPAP trial. Like, you use it
Yep.
if you need it. But if you can get a patient straight onto, long-term permanent therapy, then you should do that. The guidelines are max 6 months for a temporary appliance. So yeah, and even then, like the comfort difference between a temporary appliance and a permanent's huge. So patients have no real space for lateral movement with the hushed, and they're big because they have to be one size fits all.
Yep.
So that's a bit tricky. So we also have the Hush Mini coming, which may help, sort of alleviate some of those issues where we'll give you guys a cardboard bite fork, a bunch of cardboard bite forks that come with the point of sale display. And basically, patients just bite into that cardboard, and then that assesses them and sizes them up for their
Ah, fantastic. Yep.
that'll help them choose whether they need a mini or a standard hushed as well. So you'll get less patients that it's not suitable for, I guess, in that sense. But the other thing is that when you have a monoblock, so like when the device is joined together and you don't have lateral movement, patients just tend to get a little bit more jaw pain. We don't get as good efficacy. Like there's a number of reasons why we wouldn't use a temporary appliance permanently for a long time. Like, I mean, they could use them they could buy a new one every
Uh,
6 months. I'll take you through the products so we can just understand a little bit about that. So the Hush is the boil and bite. It's pretty straightforward. There's QR codes on the packaging and in the packaging, so the patients can scan it to get the app.
okay.
Once they have the app downloaded, it walks them through step by step. So they choose their product, and then it walks them through how the app works. So then they can, slide by slide, flick through and go, these are all the cool things you can do with the app. But it also gives them the instructions. So it teaches them how to put it in hot water, mold it to their teeth. If they're not getting the desired result, what do I do? So it takes them through all that. But we also give them some nurturing. So we give them some education and information on how permanent therapy will be beneficial for them. And then I think from there, once they transition or if they go into permanent therapy, there's a bunch of other options, and the app kind of flips and sort of updates to enable the new therapy. So if they go from a temporary appliance to a permanent, the app kind of walks them the whole way through, and that for them to be able to download that, it's pretty easy. It's just QR code on the packaging or in the packaging.
So the actual how it works is it's pulling that bottom jaw forward.
Yeah, yeah.
And is
I'll,
that, yep, okay,
Yeah, I was going to say I'll go through the mechanism action after the.
sweet.
It's
Thank
actually
you.
I probably should flip this slide to go through that first. But anyway,
That's okay. I know it's coming. That's all that
yeah,
matters.
yeah, all good. So this is our permanent appliance packaging. Comes with a dish and a free cleaner for a month. It's a nice little package, but you can see the QR code there as well. So if they didn't already have a hushed, then they can download the app and start on that patient journey through that way. So this is the appliance. So it's a nylon PA12 biocompatible material. Basically, we do additive 3D printing, which is just layer by layer with powder. We're building a 3D printed device, which is then set, and from there, we, you know, polish it and finish it and that sort of thing. The good thing about these appliances is that because we're using digital scanning technology to design the cases, we're able to get really precise fitting. So fits the patient's teeth perfectly. And also with a really strong material, like you could run a car over this and wouldn't break. And actually, someone that does this sort of similar material in a different appliance, they actually have a video where they run a car over it and doesn't break. And so that's the, you know, you don't need the precious diamond casing.
Yeah.
So they actually, because of the strength, we can make them really, really small. And because we can make them small means it's more comfortable in the patient's mouth. The other thing that we also get with that is that we don't have to protrude it as far. So if we don't have to protrude the mandible as far, you know, it means that they're going to be a lot more comfortable in that sense as well. So the reason why we don't have to protrude as far, well, there's simply just more tongue space. So the tongue doesn't get pushed back as much because of the appliance bulk. So what you find with typical acrylic appliances is there'll be lots of bulk on the tongue side, and then that pushes the tongue back and the soft tissue falls back as well. So that's kind of the basis of it. But really all it is you've got the two dorsal fins, the upper pushes the lower forward. And that's how you get your protrusion. That's how you get your mandible being pushed forward. The operating system, Resident, I'm going to do a demo in a sec, so we don't really need to talk about that. This is the patient app. If they don't have the ring, it'll give them a little thing saying, hey, you know, this is what the ring's all about.
Right. And is that CO2 ring that we've got on the shelf now?
It's different. So the ring can either be purchased through our website, or the dentist can add it to the patient's order, or the patient can choose it when they check out. So they can decide when they go through the payment process, they can choose, yeah, I want to do monitoring. It costs them an extra $300. But that's like ongoing monitoring. So the rings should last the same sort of length as the device, so 3 to 5 years. It's rechargeable, gives them nightly data. They get AHI, SpO2, and then a sleep score. And that sleep score is really handy, and it brings in actually some other metrics. So we actually use sleep staging as part of the score. We use latency, a couple of insomnia metrics as well. So overall, gives us a pretty good indicator of how sleep's going for the patient. Basically, there's a couple of ways that these appliances overall, just as a category, are titrated. So some you've got to use a screwdriver and screw them forward with like a little crank mechanism. Others, you're replacing straps. Ours is simple. You just have combinations of arches, so an upper and a lower. And then if one doesn't work, then you just use the next combination of arches. So
okay.
pretty simple. You just swap. Basically, we give them a whole bunch of combinations and they just swap them out. So, you know, if the first set doesn't work, then they use the next set and then the next set. So yeah, it's quite simple. The patients find it really easy to follow. And what we do with the monitoring is if their if their sleep score drops, then we purposely give them instructions and say, hey, your sleep score's dropped. You know, you need to go further forward. You need to advance further forward. You know, and so then we go to the next combination, and then they record the next combination. And then in the back end, you can see what combination they're on.
Yep.
As well. So it's very simple. We're the only company in the world that has it. And basically, so we have an old version of the app, which some people, you know, in your company would have seen already. The new version, I've just downloaded it now. So we've just put it into the App Store. And it should be in Google early next week. So that's pretty cool. And that has all this stuff in it that we're talking about. So that's all the new stuff. So basically, as of today and probably officially next week sometime, we'll be the first company in the world that will have ongoing monitoring for patients on oral appliances and sleep scores. We'll automatic titration through the app and recording of titration and combinations of arches and things like that. We'll be the only company that has that. So it's pretty cool. And yeah, it's hopefully... It's very, very complex in what we've built, but very simple for the patient and for you guys to see. Why we like oral appliances, obviously CPAP's gold standard, but we love it for the compliance. So patients really do, you know, like these appliances. And when they're interviewed, you know, sort of head to head, whether they like oral appliance or CPAP better, you know, overwhelmingly patients say oral appliances. Now, that's not to say that CPAP's not fantastic and it doesn't work for everyone. And you guys do a better job than anybody, but I guess what I'm trying to show here is that oral appliance therapy is something you should trust. You know that it gets good outcomes based on the research, and we only use good providers. So I think what we can show you here is that, as all your patients that don't want to do CPAP, or people that aren't suitable for it, then you've got this perfect option that you can use to send those patients to. So with this research, just basically summary is the outcomes and the CV mortality is similar for oral appliances and CPAP. So there's no significant difference.
Mhm.
Um, and I think most of that comes down to the effectiveness. So the compliance multiplied by the efficacy. So because patients using oral appliances use them for longer during the night and more often, they tend to see about the same long-term results as patients on CPAP.
Yeah.
See, and this is why mandibular advancement splints are growing so fast. So it's growing at about 3 times the rate of the CPAP market.
Mhm.
And funny enough, like the CPAP market's still growing really, really strongly. And what we've seen, and one thing that I'll just add here is everybody that implements oral appliance therapy as a good stock option within their clinic
Yep.
sees an increase in CPAP sales and diagnostic tests always.
Fantastic.
And I think the reason,
I think
yeah,
it's great. I'm keen as
I love it.
because
Well, I think,
I love having that. You know, this is your diagnosis, and we're going to lean towards this way as options, and this is your diagnosis. We're going to lean to this way as options, giving them choices.
yeah. And I think what you'll find is you'll get more word of mouth because they're like, oh, well, they're not just interested in selling me something, that I didn't want. Like you'll get that one patient that'll tell 10 people,
Yep.
and half of those 10 people you'll pick up as CPAP patients. So I think like being able to service, and we've done some independent research, mind you, it was in the US, but we did some independent research in the US with 200 physicians, so primary care physicians, so GPs, they call them PCPs. Basically, they all said that 20% of their patients refused a sleep study
Yep.
because they thought CPAP was the only therapy. So
Right.
they wouldn't even get tested because they were like, well, if I get diagnosed, which is, that's the human condition summed up. Apart from like, so this, we've got these 3 main points in this slide here, but there's one other that we talked about a lot in the other meetings was travel. So
Yep.
patients that didn't want to carry their CPAP with them when they're traveling. I think you need to consider a few things there. Like if they're super severe, I probably wouldn't be recommending getting a splint as a second device. But I think for patients that are kind of AHI 45, 40 or less, so the recent research that we've got out of the US is 45 AHI or less. We're getting really good results and pretty close to normal AHIs for those patients. So anybody under that, I'd say for travel, this is a pretty good option. And then obviously we've got primary snorers, people that just won't go on CPAP after diagnosis for whatever reason. And anyone that you've got in trial that just, is like, yeah, this is not for me. And you're always going to get a few of those. I think you guys
They
get
don't say it like that, you know.
what's that?
They don't go, oh yeah, this is not for me. They walk in and go, you can stick this.
So I think that's a good option. I mean, and that's your opportunity there to say, look, the next best option that actually works really well is the oral appliance. Let's get this started for you.
But too, sometimes, Joel, those people are hesitant to set up. So you can give them this as an option at the onset of a setup. You can say, look, if this isn't good for you, we have another plan.
Yeah, I think that's a great way to put it. Yeah, I
Give
think
them that backdoor option.
yeah. I mean, obviously with CPAP, you also don't want to set them up for failure. And like I know that some of the conversations around, well, you know, sometimes they might just go, oh, why don't you just give me that then? So I think you just weigh up. Yeah, I think whatever works for you
Your
for sure.
target.
But the ultimate goal is to get them on therapy no matter what, right? So
Yeah.
whether it's CPAP or whether it's oral appliance therapy, we've got to get them on therapy so that we know, they're being looked after. So I think, I like that strategy, and I think that will work really well. So I hope that that works for you.
Yep.
So primary snorers, oral appliances work. We know that it works for most patients. CPAP refusals, you know, you
Yep.
probably pick up a bunch, but still not all, because some of them are just stubborn and I think not ready for therapy at all. CPAP failures tend to be a lot better conversion rates to oral appliance therapy. So if they're willing to do one therapy, they tend to be pretty likely to go, okay, well, that didn't work for me, but yeah, let's go for this other option. So that's kind of, that's kind of the way that it typically goes down. And then, there's some people that, will trial oral appliance therapy and it just doesn't work for them. But usually the dentist will actually weigh them up first and be like, I don't think this is going to work for this patient because of like jaw pain that they already have or something like that. It's not common. It's probably 1 in like 40 or 1 in 50 or something like that. So it's not a lot.
So I once had a dentist tell me, one of the dentists in town, he's actually retired, who originally was doing the mandibulars here in town. And he was telling his patients that your face will hurt for the first 3 months of wearing mandibular. Is that correct?
Shouldn't.
Right. It should.
Yeah, and I think that's why we've designed the appliances the way we have, and we have a different prescription model. So most companies say, oh yeah, put the patient at 70% of their maximum jaw protrusion. And we don't do that. We start patients at 50% because we actually get much better efficacy than most devices. So what we try to do is start them at less protrusion so that they feel more comfortable, but they also get less side effects. So they shouldn't see much. There'll be a little bit of tooth tenderness, and that happens with any appliance that you stick in your mouth, whether it be like Invisalign or a night guard or whatever. But they will typically do pretty well. A week in, they'll be fine most of the time. And then, titrating them forward, we can only go so far. Once we get to a certain point, then it's like, okay, well, we can't go any further.
So when you say titrating them forward, you're saying moving that device further out, like
bit
just
by
doing
bit. Yeah,
the
yeah.
micro adjustments?
Yeah, so like a millimeter at a time kind of thing. Yeah. So the way we've just got like a couple of things that are, just throwaway lines that you can throw their way if they ask questions. Is this legitimate? What blah blah blah. There's lots of research to show that it does work, but I think the main thing is like, there's 500,000 ish new patients on oral appliances every year. And on temps like Hush, there's probably 3 to 4 million, as far as we can tell, patients every year. And from the evidence and basically from physician advocacy, we're seeing a lot more patients go on oral appliance therapy first line. So I think that there's a few things in there that you can kind of just throw off the cuff and sort of say, yeah, no, it's pretty heavily researched, and it looks, and lots of patients are using them. It's becoming a lot more common, and that's because the technology has improved as well. So over the last 10 years, we're seeing a lot more development in that space. All right. So, okay. So then you found your patient. You're like, okay, great. I've got somebody here. They seem perfect for it. We're sending you guys packs. So folders with like, there's 3 or 4 documents in there. Rosie will be able to tell you exactly. That tells them how the process works. So all the appointments they're going to do, the item code so that they can go and take it to their private health, and how to pay. So the payment is pretty simple. Like they can do it through the app, or they can do it in the clinic with you guys, and they just need a credit card, or we can call them. So there's a few ways that it can happen. So we give them an info sheet on that because some people have questions, and we just want to make it as simple as possible. So you give them the folder. And then you do the referral, so to speak, through Resident, which is the software that you guys have set up. So that'll be the next thing that I'll show you. But I'll just quickly cover, sort of rehash this again. So what we know works, and what we've seen that works really, really well with other practices, is pushing the patient to go directly to permanent therapy to the dentist first. So say, okay, the CPAP didn't work, or you want something else, or your primary snorer, I'm going to book you in with a dentist. Here's the pack. Let's get this started for you. And they might be like, oh, $1,800 a bit expensive for me. I don't know. And then you can say, okay, well, why don't you trial the temp? And that's how it generally goes for those patients.
So it's not going to be like our first line of conversation. It's the backup.
Yeah, I think temp is a backup unless someone comes in and says, I want the temp. Then I think it's like, all right, here it is.
Yeah. No.
It's
Okay.
like we don't want to deter someone if they've already made the decision to buy something. Then I think you obviously just sell it to them. But yeah, for sure, like because you'll end up. So what happens is like so there's a clinic on the Gold Coast. They do it this way where they offer it to go to the dentist first, and they still sell I would say 30 temps for every 10 permanents, right? So
Yeah.
it's still they're still outpacing temps to permanents anyway. But I think
Yeah.
if you do it this way, you're going to get a lot more permanents. That's the main sort of thing. So yeah, so we talked about the hushed already. The only thing I would say for patients when they do go on hush, and if they're potentially considering permanent, but they're going on hush, you just need to say to them, look, the hushed is much bigger because it has to fit everybody's teeth, so it's a bit bigger. It's going to be less comfortable. So just tell them that so that they know, well, the pro is a lot more comfortable and it's going to be a lot easier to tolerate. So if you tell them that early, it does go a long way.
Or if they come in saying, no, I didn't like it because it's too bulky or it's too this, you can
You
explain
just
this
Yeah,
is it.
you always want to be the first person to tell them though. You don't want to be like, obviously you don't want to be defending yourself like after they're like,
Yeah,
oh,
the
this is
product.
bulky and it's not very
Yeah,
comfortable. I don't like it. You want to set them up and say, look, this is going to be a little bit bulkier. It's double the size, if not
right.
more, of the
So
permanent. So
it's quite rewarding when you get your real one.
the permanent one is like we get really high scores from patients that have them. Everyone
Awesome.
rates it very highly.